Welcome to the Ask Brian podcast radio show, where you'll hear from some of the most successful founders and CEOs of businesses and startups, sharing their best advice for success and even some stories on how their mistakes actually make them even more successful. Now, here are your hosts, Brian and Tracy.
Welcome. You listen to KHCS 1220 and 98.1 FM, the Ask Brian radio show, every Thursday, 1 to 2 p.m. in Los Angeles. And as usual, everybody asks us every show, why is Brian spelled with an E? Our guest doesn't understand why did he spell Brian with an E. When he was going to school, it was B-R-Y-A-N or B-R-I-A-N. So every week, we have to explain to the audience. So if you've listened before, I apologize. But for those newbies that haven't heard the show, they want to understand why we have an E in the word Brian. Why is it as Brian with an E? So we have our lovely co-host. Where is she? New Mexico today? Arizona? Georgia? Florida? I don't know. I'm thinking she's New Mexico.
It's always a mystery. I'll leave it such. But yes, it's never a mystery as to why we have the E in Ask Brian. And one of the biggest reasons is because our engineer's name is Emily. Woo!
I thought it had to do with engineer being spelled with an E.
Well, engineer is spelled with an E, but our engineer's name is Emily, which is also spelled with an E, which is double excellent.
Well, what if she was an electrical engineer? Then she'd have triple E's. Electrical engineer Emily.
Wow.
She would, but she probably wouldn't be engineering our show, and that would not be acceptable with an A.
but you know, the board has all these electrical things, so maybe she has some electrical background.
Well, maybe she does. But, yeah, see, there you have it. And she speaks again. She's starting to be a little more brave and venture out more. So, love hearing you, Emily.
You know, everybody says my hair and my eyeglasses, I look like Ben Franklin with my hairstyle. And the fact is, he invented electricity when he had a little kite up there. So maybe that's why we have the E in here. Maybe that's a possibility. Or just
okay, maybe, but I don't think any of that made any sense.
Einstein.
That's a reach.
A distant relative named Einstein. Maybe that's it. Anyway.
Okay. Maybe we just keep going with our E's that we all get excited about. So, and most importantly is the word expert, because the people that we interview on the Ask Brian show are definitely experts within their fields, and they share a lot of entrepreneurial expertise with us on the show.
Well, obviously, you and I are not experts, but everyone that comes on the show is, so yes.
Well, I beg to disagree with you. I am an expert. You can say that about your own self, but I am an expert.
You're an expert in knowing the E's.
I am an expert in knowing the E's among other exceptional things.
Exceptional, another E.
Exactly.
Is this like is that like Ted's Excellent Adventure or what? Do we have an excellent?
Most days my life is like Ted's Excellent Adventure. Yes, it is.
Especially Thursdays.
Always Thursdays. With no exception.
Absolutely. Well, you know, the biggest E's we haven't even come to yet, so when are you going to come to the biggest E's?
Well, I really always like to save one of them until the end, but there's definitely, well, we're very excited. We're very excited about our guest today. We are very energetic about being able to deliver such amazing information today, and we are obviously providing excellence in everything that we do on the Ask Brian show.
Well, there's a couple you left off, but we do got to get going. So, one, grease lightning.
Yes, grease
What about
lightning.
The show is electrifying, and we're very, very, very enthusiastic. Woo!
And exhilarating.
But what's the biggest one? You missed the biggest one.
Oh,
I don't want to.
Why do you put me on the spot like this? I don't know.
Education. We educate our audience.
Well, we did say entrepreneurial expertise, so I thought I covered that. But okay, yes, the education is what you are going to receive today. There is no doubt about that.
Well, as long as we're electrifying as they do on Grease Lightning, we're very, very excited to have our guest. And do you know what his company starts with?
It's starts with an E.
And what is the name of that company?
Eucalyptus Med.
Exactly right. And without any further ado, how do you spell ado?
ADIEU.
And why do I like that word?
Because it's almost all vowels and very few consonants.
Absolutely. Without any further ado, can I get a drum roll? No drum roll. All right. Okay.
Low budget, sorry.
Low budget. I got to speak to my podcast producer. Anyway, we're back. And without any further ado, we have our guest. His name of the company is Eucalyptus Med. And his name is Jorge. Are you there?
Yes.
You survived.
I'm right here.
Stuck around. Okay.
Pleasure to be with you, Tracy and Peter.
Thank you very much.
Thank you.
You're very tenacious.
Not everybody says that, by the way.
They say a lot of things about me, but we can't repeat that because this is a live show, and there might be people under 18 on the show listening. So, I don't know. I got these big eye rolls from Emily, so I'm not sure what you're talking about. So, Jorge, before we get into your company, Eucalyptus Med, I want to go over a little bit about your background. So before you started Eucalyptus Med, what was your background?
Well, I'm an industrial engineer, and then I studied an MBA in the U.S., and my whole career I've been an entrepreneur or an advisor for other entrepreneurs. So in Mexico, I co-founded a business accelerator, and that was before I decided to drink my own Kool-Aid with Eucalyptus.
So that's an interesting question. I don't want to go too far into it, but that is a good concept. So first of all, I know what an accelerator is, but I want to make sure everybody else understands what an accelerator is. So you can just quickly explain to people what that means?
Of course. Well, in our case in particular, we were an accelerator that selected companies. They were SMEs, small and medium enterprises, and we had to see in them a lot of growth potential. So then we invested in them, and also we helped them grow. So this is like the scale-up stage in which you have a good idea that has already been proven, and then you help them escalate nationally or internationally. That's what an accelerator does.
So you have a small company, and you want to scale your business. Is that what it is?
That's correct.
And so you help them. So was this accelerator company, was that just you, or did you have a whole bunch of people helping out? How did that work?
Whole bunch of people. We were 100 in Mexico, and we were strategy consultants, but also we needed a lot of experts in recruiting. One of the key elements to scale a business is to have the best talent, and that includes not only the C-level, but also managers. So we're quite a big team.
What was your role at that company?
I was the CEO.
And you founded that company and grew it to 100 people?
Yes.
Well, congratulations. So you've already been successful once. And of the accelerated companies, how many companies do you think you did join this accelerator program while you were there?
It would be probably around 1,000.
Wow.
During my tenure. We worked a lot in tandem with the Ministry of Economy from Mexico, so they would pay part of the check, and the company would pay the other part, so that definitely helped us a lot. We also work with a lot of entrepreneurs, with a lot of aspiring entrepreneurs, because, right now, fortunately, we have a lot of availability in terms of knowledge. So, we know what's a business model canvas, or we have access to a lot of literature, but not necessarily we have access to developing the right skill set to become an entrepreneur, the right mindset. So we also focused on that and helped a lot of entrepreneurs from college to start their business.
Okay, so now you have this new company called Eucalyptus Med. When did that company start, and what gave you the inspiration to start that company?
Well, it started in 2018, and we started in a stealth mode. And the inspiration were my parents. Both are elders, or seniors, and they're dependent. And I've been their only caregiver for the last 15 years. So along this time, I found out that I knew nothing about taking care of a senior. I had to be learning on the fly. And I realized that there was nothing out there in the market to help both seniors have a better health, but also to help relatives be sure that they're well taken care of. So that was the inspiration.
So you started this company alone, or did you have other people?
I have two other co-founders. One of them is Dr. Alberto Palacios. He's a board-certified geriatrician, very respected among his peers. And the other one is Miguel Briones. He's an expert in customer experience. So he's on board because definitely one of the things that the things that you don't want to do and that you drag your feet to do is to go to the doctor. So we want to definitely improve that experience.
And so you started the company in 2018. All three of you started it at the same time?
Miguel joined one year after, but he was involved from the beginning with all his expertise in CX.
So explain how the company works in the sense of, so you're going after elderly people and providing caregivers, or what exactly do you do?
What we do is we give access to geriatricians to our patients. And the great problem is that there's only 742 geriatricians in the whole country, and there's 15 million elders. So there's not enough of them to serve them. So what we do is that we send a general practitioner to our patient's home, and this general practitioner works like a resident in a teaching hospital. And this resident has telemedicine equipment with them. So this resident performs part of a house call, and then a geriatrician joins the house call through a video call to get a diagnostic and to offer a treatment. After the house call ends, the relatives are notified of the results. So this has a lot of benefits because it generates what we call adherence. And adherence to two things. One, to doctor visits. So ideally, a senior has to see a geriatrician at least 3 times per year, and that's according with the American Geriatric Society. And the other is adherence to their treatments. So you can give a prescription to someone, but then you need to make sure that they take the medicine correctly and they take them during the right period of time to have an effect. So one of the things that we do is precisely that. We do this, and we give our patients memberships. Through these memberships, they can finish a treatment. That treatment includes all the house calls they need, and also it includes personalized follow-up by the same general practitioner that visits their home. So that makes sure that patients are well taken care of at any point in time.
So are you saying that there's like real doctor visits, or is it just telemedicine doctor visits? I mean, is actually somebody...
It's a real doctor visit. It's the benefit of telemedicine, of connecting a specialized physician on a distance, but there's a person that goes to your house and performs part of the consultation.
But is this a doctor, or it's just a geriatrician or a nurse? Or
It's a doctor. It needs to be a general practitioner. In order for us to call it a consultation, it needs to be a doctor physically present. That's how regulation works down there in Mexico.
So how is this cost effective? That's where I'm lost, okay? In America, if I want to get a physical exam, it's like a 2-month wait with COVID. And even before then, it was typically at least a 1-month wait just to get my own physical exam. And the doctor, you had to go to the doctor's office. I don't think they've had doctor visits, in over 50 years in America. And I'm just trying to understand how this is scalable and how people can do this. So can you explain it?
Yes, of course. So a geriatrician in a traditional consultation in their office, it takes them 60 minutes at least to perform a consultation. And this is because in Mexico, the private practice doctors work like lone wolves. They do everything. But in a consultation, we include a general practitioner that performs part of the consultation, which is basically the workup, the physical examination. Then you only need the geriatrician to be in a consultation for 20 minutes. So basically, geriatricians triple their capacity. So that's number one. Number two, geriatricians charge on average, I'm gonna, in dollar terms, they charge on average between $50 and $75 per consultation in their own office. We pay them $24 per consultation. So they're seeing more patients and they can even earn more per consultation. So it doesn't make sense for them. Now, in Mexico, we have a lot of very talented general practitioners. And every year there's an exam so that, the ones that aspire to study a specialty, they apply to this exam. And so there's 40,000 applicants every year, and there's only 7,000 spots. So in Mexico, we have a lot of general practitioners available, if you may. And so what we have done is take this resource and pair it with the geriatricians in such a way that makes sense economically, but also it's perfectly scalable.
So do you have this in the U.S. or is this just in Mexico for now?
Currently, this is only works in Mexico. Definitely, we're planning to go into the U.S., but this is something that we are promoting in the U.S. because we have a huge Mexican expat community that still has relatives in Mexico and they want to be taken care of. So yes, it's still in Mexico, but we would be coming to the U.S. And one more thing. In Mexico, I don't know if you're aware of this, but there's almost 2 million expats, U.S. expats living in Mexico. Most of them are retired, and a lot of them are snowbirds, but roughly half of them are permanent residents, and most of them are seniors with no access to healthcare, as I mentioned. So this is also a service that is very interesting for them, and this is one of the ways in which we're going to try to tap into the U.S. market.
Is this all pay as you go, or is there any insurance involved? In other words, does any type of insurance pay for this, like health insurance?
No, it's out of pocket. It's out of pocket right now. However, we're starting to work with insurance brokers so that collaborators of companies can have their company pay for this as part of their benefit package.
All right. My co-host Tracy had a couple of questions. Tracy has a whole bunch of questions. In fact, her list is longer than Santa Claus, so it's a big list.
I don't even know what that means, but go ahead first and talk us through what was happening on before our break about raising capital being one of your biggest challenges.
My brain goes everywhere, so that's the problem. Go ahead.
I know, it's just March 1st. You could have at least made a leprechaun reference as opposed to Christmas and the holidays. Dang. Alrighty.
Christmas in March.
Raising capital is your biggest challenge. Let's talk through that for a moment.
Of course. When we started the company, we were first bootstrapped, and then we started to raise some capital from friends and family. But then the business began to grow. So then the funds required were, it was very difficult to get them through friends and family. So back in Mexico, we tried to go to the current venture capital industry. And the great problem is that the minimum ticket for these venture capital firms is $1 million. So if your capital requirement is less than $1 million, then you're not ready to get investment from them. So we were like caught in the middle. We didn't need $1 million. So we decided to go out to other parts of the world, particularly the U.S., to raise some of that capital.
So in terms of raising capital, let's talk about it in a phase 1, phase 2. So the raising capital that you've already been successful at achieving, where did you allocate those funds? And if you're going for a next round of fundraising, where do you anticipate that you'll need to allocate those funds?
Yeah, well, the initial funds were to allocated to the development of our telemedicine platform, number one. Number two, in marketing, particularly web marketing efforts. And number three, hiring some key personnel. Right now, in our next round, it doesn't change a lot. We still need to invest more in our telemedicine platform, because it not only we use it to perform our house calls, but also the whole operation is supported by this platform. So it's very important for us to keep track of, when are we going to have a house call with someone? When do we need to give a follow-up call? So all of that needs to be scheduled. And every time we have an interaction with a patient, it needs to be recorded in their electronic health record. So doing that without having a platform, it's really a cumbersome task. So that's number one. And also right now, talking about technology, we also need to strengthen our platform in terms of compliance, of security. We're beginning to work with big corporations in pharma and in the huge insurance brokers, and they require us to have a minimal standard. So we need to be up to par. So that's a great part of the funds are going in that direction. And as I said, we still need to grow our team. We need to have more key accounts. We need to have more agents to serve our patients and our prospects. So that's where all the money is going.
So I'm curious if your background has been helping all of these other people through accelerators, how has it been challenging for you to be on the other side of being the one who is trying to build the business versus helping other people build theirs?
Well, actually, I feel a lot better being on this side. Being on the other side and just watching how many entrepreneurs are extremely successful with their ventures, with the advice that, in part of the advice that we give them, it's always in my mind. So actually, for me, it's quite the opposite. I'm enjoying being on this side. Instead of being a spectator, I'm enjoying and being the star of the film.
Well, do you think that do you find that the advice that you were giving to those other entrepreneurs, are you applying a lot of your own advice? I guess what I'm trying to say is sometimes it's a lot easier to give advice to other people and for them to take it than it is for us to take our own advice. So I'm curious if you've struggled with sort of knowing things to do, but then wanting to do things differently.
Definitely, I've tried to drink my own Kool-Aid. I try to do all the things that I advise my clients. And the realization that I have is that I still needed a lot to learn. So even though I could give good advice in many elements, there's still a lot of things that I didn't know. And so for me, this is still a learning experience.
So in helping our other entrepreneurs that are listening today, could you share maybe some of those couple of points that you really have learned a lot from?
Yes, one of the things. Well, there's many things, but one of the things that I've learned is that everything is going to be okay at the end of the day. You cannot be, too pressured all the time. You always have to think that things are going to be all right at the end of the day. So that's number one. Number two, one of the greatest advices that I could give someone is to trust others, but also to verify. And number three, communication is something very key. And there's a saying in Mexico that, if you don't communicate something, it doesn't exist. So it's very important to make sure that all the communication flows through your organization as you grow up. When you're a startup and everybody's in the same room, or there's only 3 or 4 people, it's very easy to communicate. But when you start to grow your company, some of those lines of communication are broken, and you need to make sure that information flows. When there's no information, you create a void, and that void usually it's covered by something else that you might not want. So that's something really, really important.
Is the majority of your team virtual, or do you work within the confines of an office structure?
That's a great question. So we started, we're a pre-pandemic company, so to speak. And so at that moment, we didn't have an office. And then the pandemic struck, and it made no sense for us to have an office. So we are a 100% home-based company. Precisely right now that we were answering some questions, compliance questions. They were asking, like, where are your servers? Where are they located? Those virtual servers. We don't have an office. So it's curious that we have been operating this way ever since.
And so when you were talking about the challenges around communication, what are some of the ways that what are some of the systems that you're putting in place to help you effectively communicate with a remote team?
Yes, well, you need to have different types of meetings. You don't want to have too many meetings, but you need to have the right amount of meetings with people. We have, for example, I have a meeting every week with my other two co-founders, but also we have then a meeting with our commercial team. And in that meeting with the commercial team, also other folks from operations are involved, so they can be on the loop. We have another meeting in which we talk with all of our general practitioners, and we have another meeting in which we talk with all of our specialized doctors. So all of that happens in 1 week, and we make sure that all the information is flowing. So that's number one. We always want to be in contact. Number two, one of the things that I mentioned before is trust but verify. So one of the things that we usually do is touch base with all of our collaborators in an ad hoc basis to see how they're doing and to make sure that they have all the tools to do that work, and at the same time we're verifying that they're actually doing it. So it's a lot of contact without making it too overwhelming.
Right, because that's a lot of different cooks in the kitchen, and that's a lot of different people to manage communication flows. I'd like to circle back to something that you mentioned that I'd love if you can elaborate more on. So you were talking about collaborating with the pharma companies and the insurance companies. How will that change the dynamics of your business, and will it also change the way your business model is structured?
Going with pharma, working with insurance companies is our B2B2C strategy to expand exponentially. Right now, the efforts that we have done through web marketing, we're basically done to test our product in the market. With pharma, for example, one of the greatest problems is adherence to treatment. So what we're doing is we're starting with work with them with some patient adherence programs, in which we're going to make sure that they're taking their medicines correctly and that they're finishing their treatments. That's huge for pharma because we're increasing their sales, and they can track that ROI perfectly. In case of insurance brokers, we're offering a product that doesn't exist in the market, so for them it's really beneficial that they can have another product in their portfolio, and it's a unique product. There's nothing like it out there. So for us, that's the way in which we're going to scale in Mexico, and it doesn't change the way we're doing business. From the beginning, we wanted to structure the business such a way that we can scale with opportunities like this. What changes is that we're gonna start to have a larger footprint in the whole country. Right now, we have presence in 3 cities. This is going to force us to start hiring general practitioners on the ground in many cities in Mexico. But the tough part, so to speak, we have already done it, which is to create this platform to run all of it.
And so since you brought the 3 cities in Mexico up, I'd love to hear your perspective on expanding outside of the country. So you obviously have an aggressive plan to expand within the country of Mexico, but what are your plans for expansion outside of Mexico, and what's involved in that?
Yes. So obviously we want to expand to other countries in Latin America, particularly Spanish-speaking Latin America. There are countries that have similar challenges as Mexico and also have a similar infrastructure. So we believe that this model can be replicated in those countries. one of the things that's going to help us a lot in this replication is that also there's a lot of expats from these countries living in the U.S. And if we successfully start serving the Mexican expats and their relatives in Mexico here in the U.S., then the work can be spread to other of the expats of Latin American countries, so they can hire this for their relatives living back home. So that's our initial strategy. And naturally, if there's changes in regulation in which it's more flexible to do international telemedicine, we would obviously love to enter the U.S. market. My in-laws, they're from the U.S. and I'm amazed that they don't want to go to see the doctor because of the experience that they have, or if they want to see a doctor, they need to wait 2-3 weeks for that to happen. And I think that there's a great need also for in the U.S. for a product like ours. So if international telemedicine regulations are flexible, then we might actually come here too.
Who would be your competition within Mexico, and then who would be your competition when you entered the U.S.?
Yes, so in Mexico, we don't have any direct competitor. I would say that the closest to get a direct competitor are the one-man show geriatricians that do traditional consultation. There's some competitors in the market, like the brick-and-mortar traditional hospitals that are trying to incorporate telehealth. There's other very novel competitors that are doing insurtech, and one of them is called Sophia. And what they do is they offer unlimited consultations through telehealth with their clients for a fixed amount per year. The issue is that they don't serve people that are 65 years or older. So there's a lot of people don't want to get into this industry, the senior industry. So we're taking that as an advantage right now. And in the U.S., I would say that the largest competitor that we would have, it's called Papa Health. They're a company that started in Florida that has been very successful initially to having peer support for elders. So someone younger would be paired with a senior and help them in different arenas. But right now they have expanded also into healthcare. So I guess they would be our main competitor.
Why do you think that nobody is in the industry in Mexico going for people over 65? Is it that they don't have the money, or is it that, because usually competition rises. So usually if something is going to be successful, it's usually a good indication when somebody says you've got competitors. When I hear that you don't have competitors, it scares me that why not?
Exactly. I think, it speaks to the system. As I mentioned, the medical system believes that you can treat seniors the same way you treat younger adults. So there's no urgency. There's no need to treat them in a different fashion. So I think that that's ingrained in the system, and right now, simply people are not paying attention to it. And also, because it's a very, very hairy, very difficult problem to solve. And also because there's not a lot of resources available. As I mentioned, there's only 742 geriatricians. There's a lot to be done, but precisely because there's a lot to be done, for example, the government is not making huge campaigns saying, hey, go visit your geriatrician, it's the right doctor. They're just doing it because there's not enough geriatricians. So it's like a self-fulfilling prophecy. That's my insight on this.
What's your expected growth rate over the next 1 to 5 years?
Well, the this year we expect to have $1 million in revenue, a little below that. The next year is going to be 5, the following year is 36, and the next one is $87 million. That's the hockey stick. That's huge growth, and that's only in Mexico. And the reason why this makes sense, or what this is going to happen, is because we're going to have a renewal. We have a very high renewal rate. It's above 80%, so that helps us a lot. And the other thing is that because right now we're selling memberships and they're exclusively house calls, but on top of that, we're upselling other elements. For example, medicine delivery, right to your door. In Mexico, that's a huge issue. The market is very opaque, so there's an opportunity there. Also, we're delivering insurance, particularly for fractures for seniors. We're delivering assistance in case of emergency. So we're upselling little things that are very necessary, but we're piggybacking on the network effect we're creating. That's why we have this very interesting growth rate.
Thank you very much. Listen to KHCS 1220, 98.1 FM. Thank you, Jorge. Thank you, Tracy. Till next week.
Thank you.
We'll see you next week.
Thank you.
Thank you for tuning in to the Ask Brian radio show. You can listen to us every Thursday on KTHS AM 1220 and FM 98.1, or via Facebook Live, or anytime wherever you listen to your podcasts. Visit AskBrian.com to join the conversation and ask us your business questions, and we'll answer them on our next episode. That's AskBrien.com.